Hi, this is Brenda Schwarzbach, and this is a wonderful application that you can do for someone who's just sitting in a chair, anytime, anywhere. As with all creative healing treatments, it's best to do the general treatment first. And with headaches, if they have tight shoulders, work on their shoulders a little bit to get the circulation going before you do the next part. The key to the treatment for headaches is to loosen the attachments of the muscles at the cervical vertebrae. In order to do this, you need to get the cooperation of your client. If they hold themselves too tightly and do not let you move their head, it will not be very effective. Be gentle but confident, and you will have better luck. When working with a common headache, you will create space between each of the cervical vertebrae by moving the neck to one side and then holding your thumb or a finger on the attachment and then moving the head in such a way that the muscle or tendons have an opportunity to stretch or to return to their natural position. Many times the problem in common headache is in the middle of the neck, around C3 or C4, but any of the vertebrae may be displaced. Since I feel this treatment is so important and is used so often, I'm going to show you the movements in a couple of different angles to best illustrate what I'm doing. The text describes using your thumb as a way to do this movement, but for me it's much more comfortable to use my index finger, so I'm showing both ways. You will place the index finger or the thumb on the vertebrae that is displaced, then open the joint, and then rotate. You could do this in just one place if the person has just one vertebrae that is displaced to one side or the other, but I usually do both sides of the neck for each client, beginning with C7 and working my way up. For migraine, the topmost vertebra just underneath the skull is generally displaced to the right, but check both sides. The place for epilepsy is the lowest most spot between C6 and C7. This is usually done with the thumb, and if you can feel the displacement, take your time. Remold the substance and wait for it to yield. As a massage therapist, many of my clients are lying on a table rather than being seated. In some ways, performing the movements for headaches is much easier with a client lying down. They are more relaxed, and I feel I have more control. Turn their head, slide the fingers between the vertebrae, and then bring the head back to center so that the chin is straight up. Never move their head past the center line. See the text for more information about these particular treatments, and thanks again for joining me.